Colorado Public News sat down with members of the House of Representatives from Colorado to determine how they're voting on repeal of the health care bill and what provisions are causing them to vote yes or no.
There are so many things wrong with Obamacare, to use shorthand. I don't think it can be reformed. I think we just need to repeal it entirely and start over. One of the big problems with it is that it's based on flawed numbers. For instance, it includes 10 years of income, but only 6 years of outlay. So that's cooking the books right there. It includes unrelated things to try to make it balanced, like student loan, so-called reform, or the Class Act, long-term disability care. Once again, that's 10 years of income, but only 5 years of outlays. So it makes the numbers look better than they really are. There are just so many things wrong with the accounting. It can't be believed. The CBO director, Doug Elmendorf, has admitted that it's based on assumptions that are not sustainable in the long run. It doesn't include the doc fix, which is a key part of healthcare provision. So you take out a big expense, set it off to the side and say, we'll deal with this later, and say, but the rest of it balances. That's not honest. It's not based on honest accounting. So that's one of the biggest flaws. The numbers don't add up. Also, I think it's unconstitutional. It is a mandate that tells every American, by virtue of you being a living, breathing person, you have to buy this product, whether you want to or not. That's never happened before in our nation's history. Courts have been agreeing with that, not uniformly, but I know it's going to go all the way to the U.S. Supreme Court. But I think it's unconstitutional. It's got the potential, I think it will actually lower health care because you're bringing 30 more million Americans into a system. Now, right now, everyone does get emergency care. But with health care, you can use it for whatever purposes. And as P.J. O'Rourke has said, you don't know how expensive something is until it's free. So when something is supposedly free, everyone's going to use it to the max because they think someone else is paying for it. So you bring in 30 more million Americans, but yet you have this current number of hospitals and doctors, nurses, other practitioners. How can you give that expanded care without rationing? And it will lead to rationing. And that's how countries like in Europe, England, Canada, that's how they balance their books when government takes over healthcare, is they ration the provision of services. I have a big problem with the expanded government control. It's got, at latest count, 159 additional government agencies, bureaus, and departments. So, and CRS, Congressional Research Service, has said we don't know exactly the full number of agencies that will be created. I think a better approach is to base healthcare on free market solutions. We have a good system now, although it's kind of a hybrid of socialized approaches to healthcare and free market. It's not a pure system one way or the other. It's kind of a hybrid. I think we need to emphasize free market economics and approaches to healthcare. For instance, let people buy insurance across state lines through expanded competition. Let's have tax equity where every person gets the same break that a corporation gets for its employees. That would lower the cost of healthcare right there and make the cost more affordable for everybody. Let's have national associations. I know realtors, for instance, they'd love to have national groups, and by virtue of their numbers and economies of scale, they could offer a lower priced product for every member of their group. So we're being able to buy across state lines. Let's have tort reform. That wasn't even addressed in the legislation because it's a powerful trial lawyers lobby that has prominence in the Democratic Party. So they did not even consider that, and yet tort reform is something that has the potential and the promise of lowering costs, and that should have been part of the discussion. So we have a lot of free market approaches and other approaches that would increase competition and lower costs without having a government takeover. And that's the bottom line for me. Obamacare is a government takeover of 1/6 of our economy, and I'll do everything I can in the future to repeal it completely.